Today, I am your teacher and your health six subject. So by the way, I'm Mr. Zane P. Blanca Flor. Okay, class, are you ready? Yes, of course, thank you so much. But before we start our lesson this morning, I want everybody to please stand for our stretching exercises. As we all know, the stretching exercises is for muscle toning. Yes, of course. So now, let's start our stretching exercises. Let's begin with shaking our hands. Ready? Go. 1, 2, 3, 4, 5, 6, 7, 8, 9, and 10. Next one, we have neck bend. Ready? Go. You follow me. 1, 2, 3, 4, 5, 6, 7, 8, 9, and 10. Reverse. 1, 2, 3, 4, 5, 6, 7, 8, 9, and 10. Push it up. 1, 2, 3, 4, 5, 6, 7, 8, 9, and 10. Push it down. 1, 2, 3, 4, 5, 6, 7, 8, 9, and 10. Okay, this time, let's have a shoulder circle going forward. Go. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Backward. 1, 2, 3, 4, 5, 6, 7, 8, 9, and 10. Okay, next one. Hands on your waist and let's do the inhale, exhale. Inhale. Exhale. Inhale. Exhale. Inhale. Exhale. Okay, next, shake your hands. 1, 2, 3, 4, 5, 6, 7, 8, 9, and 10. Okay, thank you very much, class. So please be seated. Okay, class, before we start, let's check first your attendance. Okay, is there any absent? Class, are everybody present? Okay, very good. So, today, all of you are present. So, we have a complete attendance today. So, before we go to our discussions, let me remind you first some things to remember. This reminder is very important in our online class discussions. First, please pay attention. That's very important. Second, always sit in one place. Third, avoid doing unnecessary movements. Fourth, please participate in the class discussions. 5, kindly ask questions if necessary. And of course, the last one is get ready your pen, your notebooks, and of course, your modules. Is that clear, class? Is that clear? Of course, thank you so much. So please, the next one are the words to thunder. I'm going to give you some meaning of this word because as we go along with our discussions, you are going to encounter this for you to understand very well. The first one is what we call the underweight. Underweight is always means too low to be healthy. And of course, the overweight means increase in body weight. The other one is what we call the swimmer's ear. A disease or one of the ear problem. And take note, it is a painful problem. The next one is the otitis media. It is an ear problem found in the middle ear caused by infections. What about gingivitis? Gingivitis is a gum disease. It is a gum disease. Take note of that. And of course, we have the malocclusion. Malocclusion is the misalignment of the teeth. And the last one, of course, we have the bad breath, also known as the halitosis. Okay, so this morning, before we proceed to our lesson, I'm going to ask you first one question. When you hear the word help, what comes into your mind? Amalia, very good answer. According to her, when she heard the word help, it refers to the medicine. What about you, Heidi? When you hear the word help, what comes into your mind? Very nice answer. It's a balanced diet. Thank you so much. And what about you, Joanne? When you hear the word help, what comes into your mind? Very good. Healthy food, according to her. So by the way, class, only your answer are correct. When we hear the word health, definitely that comes into your mind. The medicine, the balanced diet, the nutritious food, and of course, and a lot more. Okay, so class, this morning, we are going to study the personal health issues and concerns. One of that is what we call the stunted growth. Stunted growth means the moral growth rate in a person has been reduced. It is due to malnutrition in an early childhood. At the same time, it is learned that when the vital organs are not fully developed, of course, during the childhood, premature death in the latter life can result. You see, that is what we call a stunted growth. So now, in the stunted growth, we have the weight issues, the body weight, and then the body mass index or the BMI. Under the weight issues, we have the what we call the underweight. When we say the word underweight, according to the body weight, too low to be healthy. Okay? And the body mass index or the BMI of the underweight is only 18.5, or weight is 15% to 20% below normal, and for the age of height group. You see? In the weight issues, we have also under the stunted growth is the overweight. Okay. Overweight means increased body weight in relation to height. And the body mass index or the BMI is only, the weight is only 15% to 20% above normal for the age of the height group. Okay. That is what we call the weight issues underweight, and at the same time the overweight under the group of stunted growth. Okay. Okay, class. The second personal health issues and concern is we have the hearing. When we talk about hearing, it refers to our ears. Hearing is of course related problems. Example, impacted cerumen, swimmer's ears, and of course otitis media. Take note, class. When we talk about cerumen or earwax, when pushed against the eardrum of the cotton buds or by hairpins, blocks the ear canal and causes hearing problems. That is, causes hearing problems. Okay, take note of that, class. Please listen very well. When water is trapped in the ears, bacteria or fungal organisms in the water will most likely, of course, spread in the inner ear area. The result is very painful condition called swimmer's ear, which result from infections. This condition needs to be treated at once by the doctor. That is what we call class B, swimmer's ears. That's why when you take a bath, you need to be very, very careful. The next one is what we call the otitis media. Otitis media is also a common in children because the tube that allows fresh air in the middle ear is not fully developed. Since it is not fully developed compared with the adults, of course, children experience middle ear infections when they have viral or bacterial infection caused by common colds. Okay? That's why we need to take care, of course, our personal health to avoid such common colds, because common colds is very common to children like you. Did you understand, class? Amalia, still listening? Very good. Are you with me, John? Of course, good. Now, the next one belongs to the personal health issues and concern is what we call the vision. When we talk about vision, it refers to our eyes. And vision consists of the astigmatism, myopia, and hyperopia. Public class, when we talk about astigmatism, meaning is a common eye condition experienced by many young people. This condition can be corrected by eyeglasses. The exact cause still is not fully known. On the other hand, we have the nearsightedness or myopia. This means has become common lately. Nearsightedness persons can see objects that are close but have problems seeing objects that are far. The exact cause of this is increasing number of those who have myopia still is fully known, not yet fully known. And take note, however, many eyes doctors would say that it has something to do with eye fatigue, or exactly by the use of the computers. There's a reason behind why a lot of people right now suffering from myopia. Okay, class, therefore, all of you are still young. That's why you need to take care of your vision or your eyes, because eyes is very important. Personal health issues and concern is what we call the oral, at the same time the dental problems, which includes cavities, gingivitis, malocclusions, and halitosis. The first one is what we call cavities occur as a result of the tooth decay. Tooth decay when the tooth structure is destroyed. This can be presented by proper brushing of the teeth. Therefore, student, my dear learners, please always brush your teeth to avoid such cavities. The second one is what we call gingivitis. Gingivitis is a gum disease. The bacterial growth in the mouth will cause destructions of the tissue surrounding the teeth. Eventually, the result is tooth loss. The next one is what we call the malocclusion. Malocclusion is another word for misalignment of the teeth. Other words for the condition is crowded teeth. This condition may cause health problems. It is not addressed properly. Okay? That is what we call malocclusions. The next one under oral and dental problems is what we call the bad breath or the halitosis. Okay, take note of this. Bad breath or halitosis is caused by certain foods and poor dental and oral hygiene. Proper toothbrushing can prevent bad breath. Okay, class. Are you still with me? Yes, of course. Still awake? Still enjoying our discussions? Very good. So take it, class. to avoid cavities, to avoid malocclusions, to avoid bad breath or halitosis, what are you going to do is always proper brushing of our, or shall we say of your teeth. That is what we call brushing of our teeth is very important. Okay. Do you have any questions? Do you have any questions? Amalia, come on. Yes, what about Joanne? Yes, Heidi, over there. Julie, what about there? Okay, very good. No more question. Oh my God, that's very nice because all my learners are still awake. They are very much interested about our lesson too. The fourth one is what we call the skin, hair, and nails, which, of course, what do you call this? Belongs, or shall we say, consists of the sunburn, dandruff, corns, blisters, calluses, and others ingrown toenails. First one is what we call the sunburn. Take note of this, guys. Sunburn is caused when the skin is exposed to the sun for a period of time. The skin burns, turn red, and it will be irritated. Sunburn can cause skin cancer and deadly melanoma. And that is my class. Take note of this. Please do not expose yourself under the heat of the sun because we exactly get sunburn definitely from the direct sunlight. Okay? So that's why take care of it. The next one is what we call dandruff. Dandruff is marked by flaking or drying of the skin on the scalp. It is itchy sometimes. That's why it makes a person feel uncomfortable. It is not contagious, painful. It is not contagious, but it can be embarrassing. And of course, part of it, hygiene is very important. That's why we need to take care. We need to take a bath rather. We need to take a bath every day. And we need to apply, of course, shampoo on our hair to avoid dandruff. The next one is the corn and calluses. Corn and calluses exactly are thickened, hardened layers of the skin on the hands or fingers, and especially on the toes and feet. They grow when these parts of your body are rubbed against hard surfaces. That is what we call corns and calluses. How among of you here right now have corns and calluses? Anyone? Okay, this is good. No more corns and calluses on your hands or even in your toenails. That's good. Meaning you are very, what you call this, very nice. Why you know how to take care of your, what do you call this, of your body parts to avoid corns and calluses. So under the, of course, the nail is what we call the ingrown toenail. Ingrown toenail, of course, results when the nail is curved that grows into the skin usually at the sides of the nail. It is caused by improper size of a footwear. At the same time, it can also be caused by fungal infections. Oh my God. So meaning, again class, as what I have said earlier, we need to take care of our body. We need to remember always the essence of hygiene. Because hygiene is very important to avoid those fungal infections. Okay? Here are issues and concerns. So we have the posture and spine disorder. When we talk about posture, is referring to our physical aspect. We have a very nice posture because we don't have spine disorder. Okay? We have the two spine disorder. The first one is the scoliosis, and the other one is the lordosis. Okay, class. What is scoliosis? When we talk about scoliosis, it's the sideways of curving of the spine. It takes place most often just before puberty during the growth spurt. Take note, children who have a mild case of scoliosis should be mentioned closely. Okay, at the same time, the second one is the lordosis. Lordosis is a condition when the spine in the lower back has curved excessively. This can cause pain as the spine is pressured in excess. Therefore, class, we need to take care of our body. We need to take care of our body every now and then because, as we all know, that posture is also very important. Once we destroy our spine, everything will destroy because spine is the foundation of our body. Class, always remember to avoid personal health issues and concern. The very most important things that you are going to remember is we should always consult our doctor for some precautionary measures because doctor is the best person who can tell us what is all about the diseases. Okay? Okay, class, do you still have any question with our lesson this morning? More questions? Did you understand well? Wow, that's nice. That's great answer. Thank you so much for that, class. So since you don't have any questions, of course, I will be the one to ask questions. Okay, class. As you remember, what are the 6 personal health issues and concerns? Remember what we discussed a while ago? Yes, Amalia, the height and weight, very good. The second one, John, as you remember, the hearing, that's good. What about you, Juby? The third one, vision. Next, Malu, the fourth one. Very good, the skin, hair, and nails. Alicia, the fifth one, posture or spine disorder. And of course, the last one we have, yes, Jerry, oral and dental problems. Thank you so much, class. So, those are the 6 personal health issues and concern. Okay, so before we proceed to our last part, I guess, I want you to get a piece of paper and, of course, listen to me because I'm going to dictate your 5 items next. Okay, are you ready? Very good. Okay. First question is, it is a medical condition in which person's spine has sideways curve. Okay? Very good. Scoliosis. The second one, it is a reduced growth rate in human development. Very good. We have the underweight. The next one, the third one rather, it is a small pocket of body fluid within the upper layer of the skin. The blister. And the fourth one is, it is defined as abnormal or excessive fat accumulations that presents a risk to health. What is that? The stunted growth. And the last we have, it refers to eye movement, control, and eye movement coordination. Very good. We have the vision. Congratulations to all of you, class, for participating well in our class discussions. So, always remember, your assignment is also very important. So, as a continuation, please still study other parts of the personal health issues and concern, which is all about the nose, the mouth, the teeth, and of course our body. So we still have a lot of personal health issues and concerns. Any question, class? No more? Okay? So, before we leave, everybody please stand. So let's have first a jogging exercises to make our bodies feel awake, alive, and alert. Ready? Go. 1, 2, 3, 4, 5, 6, 7, 8, 7, 6, 5, 4, 3, 2, 1. Next, we have the jumping jump. 1, 2, 3, 4, 5, 6, 7, 8, 7, 6, 5, 4, 3, 2, 1. Okay? So please be seated. So class, that's all for today. Thank you so much for listening. See you tomorrow. Goodbye.